Okay, hello everyone. My name is Hannah. I'm an occupational therapy student from UTMB. Today I'll be talking about healthy aging and promoting physical exercise across the lifespan. We're going to primarily focus on healthy aging and fatigue today. So I'll talk first, and then Kelly will come in later and talk about energy conservation principles. So for our table of contents, we're going to start by talking about fatigue, and then break it down into heart disease and lung disease. So what is fatigue? Fatigue is feeling overtired with low energy, which impacts our ability to actively participate in functional activities. Research tells us that increased fatigue is a common complaint of older adults, especially over the age of 65, with 50% of older adults reporting chronic fatigue, which is associated with decreased quality of life overall. Fatigue is one of those things that can be traced to our habits and our routines. So think about your lifestyle. Alcohol or drug use is going to increase fatigue, excess or lack of physical activity. So if you're doing too much exercise or not enough, so finding that right balance of activity is really important. Medication, so your side effects from your medications that you're taking, poor sleep and poor nutrition. So those are our lifestyle. Fatigue may also be a symptom of an underlying condition. So if you're noticing that you're really fatigued on a daily basis and you're not really sure what's going on, maybe talk to your doctor because it could be a medical condition. Today, you're talking about heart disease and lung disease. Next time, we'll talk about cancer-related fatigue and COVID-19 fatigue. So heart disease is an umbrella term, refers to several types of heart conditions. Today, we're primarily going to talk about coronary artery disease, or CAD, which is the most common type of heart disease in the United States. So our coronary arteries, these are blood vessels that supply blood flow to your heart. So what happens with CAD is that plaque builds up and that grows in the coronary arteries, which then disrupts blood flow and oxygen to our heart. So with that plaque, our arteries become thicker and harder, so the plaque breaks off and then forms a blood clot in the arteries themselves, and this can lead to a heart attack. In addition to that, the strain from the coronary arteries on your heart can also lead to a heart failure. Here is just a diagram looking at the process of coronary artery disease to give you a visual of what this looks like. So some statistics about heart disease in the United States. According to the CDC 2021 update, heart disease is the leading cause of death in the United States. CAD is the most commonly diagnosed heart condition, as we mentioned earlier, with 400,000 people nearly being diagnosed in 2019. In addition to that, 18.2 million Americans age 20 and older have CAD. So it's not just the older adult population, you are seeing it younger too. So it's important to take those preventative measures early so we can reduce the onset of diagnosis. Here is a map of the United States and the rate of heart disease death in the United States. So as we can see on the right-hand side here, those areas are mostly impacted by heart disease. And that is mostly due to low socioeconomic status and poor lifestyle, and also just access to healthcare. Texas, as we can see, is on the higher range of that too. So heart disease is definitely prevalent. Some risk factors to consider. So we have non-modifiable, so things that we cannot change, such as our age, our gender, and our family history. And gender, I really should say sex. So for age, if we are over the age of 45, for postmenopausal women and men over the age of 45, we see an increased risk of coronary artery disease. For sex, we're seeing that males are mostly diagnosed, and that can be due to lifestyle factors and also increased alcohol and drug use. Family history is a big one. So if you know that someone in your family has been diagnosed with heart disease, especially CAD, then it's important to talk to your doctor early. Some modifiable conditions: smoking, sedentary lifestyle, high LDL cholesterol and low HDL cholesterol, as well as high blood pressure. These are all things that we can change to prevent and reduce that occurrence of CAD. So some signs and symptoms to be aware of. If you're experiencing chest pain, you're not really sure what's going on or why it's occurring, that's a concern. Shortness of breath, and then fatigue. If you're experiencing these three things and it's not changing, then it's probably important for you to talk to your doctor and see what's going on. Because what happens with CAD especially is that we don't often know that we have it until you have a heart attack. It's one of those things kind of just silent unless you are being proactive early on. So research and talking about heart disease and fatigue. Fatigue is a common symptom that is reported by individuals with CAD. Fatigue is linked to poor cognitive performance and worse health-related quality of life. In addition to that, fatigue is a symptom of depression. It is the most common comorbid mental health condition for individuals with CAD. With that being said, social support is a determinant of subjective fatigue in people with CAD. So engaging in group physical activity with a strong sense of community may reduce or alleviate feelings of fatigue, which you can find at TriFitness Gym because there's a strong community here and we see that daily. Having those connections is important in reducing fatigue. The benefits of exercise. Living a healthy lifestyle will definitely prevent the onset of CAD. Introducing those preventative measures early will reduce the onset. In addition to that, cardiorespiratory fitness, especially aerobic exercise, including those activities into your routine, such as running and jogging, swimming, biking, those will improve your quality of sleep, which will help reduce feelings of fatigue. Also, including a warm up and a cool down into your exercise routine may help to reduce chest pain and protect your cardiac function. So getting their heart rate down before you go back and do your daily activities is important. So with that, also engaging in 150 minutes of moderate intensity aerobic exercise has been shown to decrease the risk of cardiovascular disease as well as mortality. And a picture on our right, we have our moderate intensity activities examples, such as biking and walking. So these are some things you should be doing 150 minutes a week to reduce that risk of heart disease. For contraindications, the risk of exercise-induced cardiac event for individuals who are chronically sedentary and engage in vigorous intensity activities abruptly, there's a small risk. So if we're sedentary for a long period of time and then we try to just jump into vigorous activity, like running around or jogging, jump roping, these are things that are gonna put a lot of strain on our heart, especially if we already have a diagnosed heart disease condition. So there's a small risk of having a cardiac event in that case. So with that being said, it's important to gradually incorporate physical activity into your daily routine. And also listen to your body and pay attention to what's going on. So if you're experiencing dizziness or chest pain, then you probably should stop doing what you're doing and take it easy. For individuals with acute coronary syndromes, such as heart attack or unstable angina, they should avoid vigorous intensity activities until they're asymptomatic for at least 1 week. And as always, it's important to consult your doctor prior to engaging in physical activity. So now we're going to move on to lung disease. Again, lung disease, a term, this is just an umbrella term as referring to disorders that impact our ability to breathe. So for lung disease in the United States, some common conditions that we see are asthma, chronic bronchitis, emphysema, infections, and chronic obstructive pulmonary disease, so COPD. According to the CDC in a 2021 update, COPD is the 4th leading cause of death in the United States. COPD affects more than 15 million Americans, and more women are impacted by COPD than men. And this is for a couple of reasons. One, in the past, COPD was considered a man's disease in that women were not being diagnosed until later stages, in which it was more advanced. And also, the smaller amounts of smoke for a shorter period of time can impact women's lungs more than men just because of the size. So it's one of those things. Here's a map again in the United States. As you can see, the same kind of region that we saw with heart disease is still impacted greatly by respiratory diseases. So this is definitely an issue. Okay, so what COPD is, this is often preventable. It's a pulmonary disease that includes chronic bronchitis and emphysema. With chronic bronchitis, our bronchi are becoming inflamed, which is interrupting our ability to breathe and exchange gases. And then emphysema, our alveoli have now become weakened, which is disrupting our, again, that breath. And so we have shortness of breath with emphysema. So the combination of these two things is why COPD is so fatal in the United States. Okay, so our risk factors. Smoking is the biggest risk factor for COPD, with 85 to 90% of cases being caused by smoking. So again, COPD is preventable for the most part because smoking is such a big part of it. But exposure to air pollution, breathing secondhand smoke, working with chemicals and dust on a regular basis, and if you have a history of childhood respiratory infections, this can also cause COPD or there's an increased risk of developing it. Some signs and symptoms to be aware of include chronic cough, shortness of breath, frequent infections, fatigue, sputum, and wheezing. And sputum, that's just mucus buildup that happens in our lungs. So if you're noticing some of these things, or if you know someone who has symptoms like this, maybe consider talking to your doctor, because they're definitely concerning. With COPD and fatigue, fatigue is definitely highly prevalent in individuals with COPD. What happens is that we enter this cycle of inactivity. So we're feeling breathless, and then our body starts to feel tired because we're not getting the O2 that it needs. Then we start working out less, and then we have less stamina overall. So we're in this whole cycle where we can't break out of it because we're tired, fatigued, we can't breathe. And so it's hard to break out of that cycle. So it's important to break out of it early, so that way we can keep on exercising, because as we'll talk about in just a second, the importance of exercise, especially if you have COPD in the early stages. Okay, so as I just mentioned, regular exercise is definitely important, even if you have COPD. So according to the American Lung Association, engaging in physical activity improves your body's use of oxygen, which will increase your energy levels. So it'll break out of that fatigue or inactivity cycle. So this is a big step, doing regular exercise. With exercise, stretching is definitely important. So what happens is that our respiratory muscles and our lungs aren't getting the movement that we need because we're scared to start moving and getting energized, right? So we have like this folded in feeling. We're not expanding our lungs, we're just folding in. So it's important to do some stretching, especially if you have COPD. So getting movement to our thoracic spine, start to build up our flexibility. And with that being said, also open up our chest, get our pectoralis major and minor going. It's definitely important to open up our lungs and help that chest expansion so we can breathe. Aerobic exercise, definitely take it easy. Do some walk-ins, swimming, biking, but just follow your own pace, okay? Keep it gradual. For strength training also, strength training is a huge part of our exercise routine, maintaining our muscle and keeping up with our strength and our fatigue, or fighting fatigue. Strength training has been shown too that for individuals with COPD, they find that it increases their motivation to exercise because it keeps things interesting and you can kind of work different muscle groups. Some breathing techniques to include if you have a lung disease and you are experiencing shortness of breath, pursed lip breathing. So in this practice, you inhale for 2, exhale for 4, and you're breathing out like you're blowing out a candle. So it's very small breathing, small breaths. So that way if you're experiencing shortness of breath, you can kind of regulate your breathing and get back to a normal rate. Some contraindications. Again, exercise is safe for individuals with COPD. However, you should avoid physical activity if you're experiencing a fever or an infection. If you're nauseous, if you have chest pain, if you're out of O2 and you're seeing blurry sights and you can't focus, then they should stop doing physical activity. So in conclusion, subjective fatigue is commonly reported in individuals over the age of 65. Fatigue may be linked to your habits or your lifestyle, or it can be linked to a medical condition. Always communicate with your primary care physician if you're experiencing chronic fatigue and you're not finding what's working for you. Physical exercise will reduce feelings of fatigue and decrease that risk of developing a chronic medical condition. So engaging at least 150 minutes of moderate intensity exercise may reduce or alleviate any symptoms of a medical condition or reduce the risk of being diagnosed. It's important to also listen to your body if you're experiencing symptoms such as chest pain, dizziness, or nausea. And also to keep gradually increasing the intensity and the frequency of physical activity. Don't start really hard right away. Gradually introduce, that way your body can get used to it and build up that stamina. All right, with that being said, I want to thank you for listening to this presentation, the first portion with me. If you have any questions about any of the information I just shared with you, please feel free to email me. I'd be happy to help out or do some more research to help you. And here are my references just for you to have. Going back, pausing a little bit. There we go. And then with that being said, we're going to move on to energy conservation, and Kelly is going to take it away.
All right. Hi, guys. Thank you so much for still listening to us. I'll make sure this one's a little brief, but just a couple of tips so that way you can conserve your energy and have optimal participation throughout your day-to-day use. So what is OT? You're probably wondering what we're doing, what we're talking about, and how this applies to you. Well, we are OT students from UTMB, and what we're studying is helping people across the lifespan by creating a treatment plan specific to the individual based on what matters to them the most. So we do that through rehab. And so we're working on ADLs, which are activities of daily living. So that works on like grooming, bathing, hygiene, oral hygiene, dressing. And then also meal prepping, transportation, like how you're doing things. And so that's a little bit about what OT does. And we work on exercise, endurance, strengthening to get you back. So that way you can improve your quality of life after an injury or anything that happened. So what's energy conservation? What am I talking to you about? So it's important to adapt the way that you carry out your day-to-day activities just to minimize the muscle fatigue, joint stress, pain. So that way you can do more throughout your day. And so it's important to use your body efficiently and do things in a smarter way. So I'll definitely give you all the tips and tricks so you can save energy, do things independently, and adapt the environment as we age. And then energy conservation techniques are just little simplification techniques that can allow you to do things with less effort and maximal performance with minimal fatigue. So why is it important? It's important to understand how much you're doing and what activities require a lot of energy and less energy. So that way you can plan your day accordingly. So that way you can have more energy throughout your day. So we want to improve your quality of life by conserving the energy and doing things that you have to do in a day versus things that, you could do or you would like to do. So that way we can spread them out on a day-to-day basis. So the first step is to find out how you spend your time and energy before making changes to any daily routine. And at the end of the presentation, I'll give out some handouts, which should be going out in the email. So that way this can make a little bit more sense. So the 4 Ps of energy conservation: prioritize, plan, pace, and position. So those are 4 Ps to help you conserve energy. The first one for prioritize is kind of self-explanatory. Begin with what's most important to you. What needs to be done today and what can be done later on. So for example, if you have to come to the gym, if you have a doctor's appointment, if you have to go take your grandson to work or school, those are things that have to be done today. So maybe dusting the living room, washing your shoes, or cleaning all the kitchen, maybe that can be done at a later time. So if you're tired, make sure that you do those tasks until you are fully rested. And so a good rule of thumb is after 1 hour of working, take a 10-minute rest break, just so that way your body can conserve energy, it can regenerate, and then you're not in any rush to do things, because often when we rush, that's whenever injuries occur. Plan out your activities. What's important to you? What do you have to get done today? And whenever you plan, you avoid those extra trips. Like I know there's sometimes, you want to cook a meal and maybe you don't have all the ingredients. And so if you would have planned beforehand, maybe you would have gathered them all beforehand. Analyze each task. See different ways that you can simplify it. Like if you need to do the laundry, maybe instead of holding all of the laundry on the way back to your room, maybe you could put it in a laundry basket. And that way, once they're dry, you just take it. And just finding different ways to make things easier on yourself. Gather the supplies and equipments before you start doing a job. For example, if you're going to go garden, you need your shovels, your gloves, your garden hoe, all that good stuff. Make sure you have everything there before you start the activity. So that way you're not having to get up every 5 minutes trying to go grab things. You're just have everything there. It's easier and you're not having to constantly reach, get up and go grab them. Plan to alternate between heavy and light tasks. If you're going to do a lot of lifting, make sure that the next thing you do is maybe seated. So that way you're not as tired. Spread activities out throughout the week. That's important because if you have 5 things that you need to do in one day, see what things that you can do later on. So that way you do spread it out. You're not as tired, because by the time you go to bed, if you're really tired, tomorrow is probably going to be a harder day since you don't have any energy. I know it sounds silly, but plan to get a good night's rest. If you know that you need to sleep about 7 to 8 hours, plan it out. If you want to go to bed at 10, make sure by 9 you're starting to wind down, you're kind of heading towards your room. So that way by like 9:40, you're already in bed resting. As you get older, It's inevitable. It's going to take longer to complete different tasks. So consider that when planning. And if you know it's going to take you a little bit longer, make sure that you implement that into your day. Use family and friends. I'm sure that you'll have great supports. And if not, y'all can always use one of us if you need help with anything. Make sure that you do ask for help whenever you need it, because putting too much work on you can hurt you in the long run. Store frequently used items at convenient heights. If you know that you're cooking and you put your pans all the way on the bottom shelf, move them up so that way it's easier to grab, because you're going to constantly have to be bending, twisting, grabbing things. Having everything at level surface is going to be easier for you to just grab it and have it right there. That will require less effort. Pace. Never rush. Maintain a slow and steady pace. We want to make sure that you're not rushing, because like I previously said, whenever you're rushing, that's whenever injuries occur and mistakes are made. So you want to also avoid holding your breath. Make sure that when you're working out and doing these things, you're breathing slowly and steady. So like Hannah previously mentioned, the pursed lip breathing in through your nose and out. And it's like blowing a candle. So you'll do that a couple of times. That's going to help with fatigue, and that'll just kind of help your muscles get more oxygen into them. Blood flow is going to help, and you'll have more energy. And it's okay to ask for help. I know as we get older, and even sometimes you just take on too many things on your plate, it's fine to ask help. I know that there's going to be people out there who will listen to you. Listen to your body and know your limits. If you know that you are overdoing it and your body's telling itself that it's tired, you need to rest, because if not, sometimes that can lead to getting sick later on, injuries and everything. Listen to your body. If it's tired, listen to it and take a rest break. Change the activity to use different joints and muscles. If you know you always do something with your hands, maybe try using your elbows. So that way, whenever you carry items, you're doing it like that. And then try to learn your capacity for work. So if you don't know what your limits are of working too hard and you want to do work longer, maybe try to go in gradual steps and kind of realize like, okay, after 10 minutes, I feel good. I can keep going. Then after those next 10 minutes, if you're feeling really tired, maybe now, okay, maybe 20 minutes is too much. Maybe I can do 15. Position. This is really important because this is what causes a lot of repetitive injuries. So bending and reaching can cause fatigue and shortness of breath. If you're constantly having to reach for things below, you're having to go above the sink, the counters, everything, you want to make sure that you keep things, like I mentioned, at a good height, so that way you're not having to reach as much. Maintaining a nice and upright posture when you're sitting or even standing. This is going to help get more oxygen into your lungs, which is going to help you work better. Even sitting unsupported for a really long period of time, it's going to hurt your back. It hurts my back, so I know it's going to hurt y'all's. And so for sure, making sure that you have good places to sit that have support is going to help you. And completing task sitting is really good. That saves so much energy. Sitting supported just helps you focus on the activities that you're going to do. So you definitely want to make sure that whenever you have the opportunity to sit down and rest, take a break. You deserve it. So in one of the handouts that I'm going to provide y'all with, this just talks about when you have more and less energy. And this is just kind of making you more self-aware of maybe when you can do things and maybe whenever you want to limit the activities that you're doing. So for example, if you have the most energy in the morning and you know that, try to do all the hard things in the morning. So that way, later on, you can do a low energy task, like we mentioned, the heavy and light. And then you can go back to high energy or moderate energy after you've rested. So this is good just so that way you can kind of take note of when you have the most energy and you know when you need to complete your task best. And how it applies, we'll talk about different tips and tricks for cooking, dressing, and bathing. So for cooking, I know it's silly, but planning your meals and ingredients is best, because whenever you're trying to cook and you're in the kitchen, you're constantly having to go back to the cabinet, get this spice, reach underneath the sink. You forgot, the Clorox wipes, or you need a pan. Now you're going underneath the oven. Make sure that you have everything all at once. And that way, whenever you start cooking, it's all right there. It's nice and put, and it's easier to do. Cook and bake in steps. Sometimes I know we are multitaskers and we try to do multiple things at once. Make sure that you do it in small steps, so that way you're not rushing and you're taking your time. Sit whenever you're cooking. If you want to stir, sit it. That's totally fine. It's going to be easier on you. It's easier on your joints. It's easier on your hand muscles. You're focusing more. You're going to be you'll be less tired after you finish. Use electric appliances. This is my favorite. I love can openers, the electric can openers. Love just putting it on there. It's honestly saving you so much energy. It's better for your joints. And I totally recommend using a dishwasher too if you have that available to you, because it'll just be easier to do. And whenever you finish, it's not as hard. Use lightweight cookware. I don't know about y'all, but there has been so many times I will hold a pan, I pick it up and I'm just like, well, that was actually really heavy. So consider using like the foil ones, put less food in it so that way it's not as heavy. Even using paper plates, like that will help a lot with just like not using so much energy to get it from here all the way to the table if it is a farther walk for you. Meal prep. If you're already cooking, just go ahead and make some extra so that way you have some meals later on that you can just pop in the microwave and it's easier for you. And then also there's meal delivery services. So if you're feeling really tired, you don't have food, we have Favor, Waiter, Uber Eats, DoorDash, and Grubhub. Those are all different apps that you can download on your phone or even use online to get food brought to you. Dressing. So laying out your clothes before getting dressed. That way you're not having to go back to your closet, get some shirts from above. You're having to get socks from underneath your drawer. Just try to lay it out, plan it out in your head so that way you know what you're going to get and it's just an easy walk. Sitting down to get dressed and undressed, I do it. It's easier for you for sure. Always make sure that you begin dressing your lower half. That is the one that takes the most energy. So if you're really tired, I recommend sitting down and getting dressed that way. Like I mentioned, bending and reaching and leaving it over, that's going to be really hard on your back and it will, over time, those muscles get weaker. So you want to make sure that you use maybe a different way to get the item. So a reacher. I use a reacher. I love it. It's super easy. I don't have to bend over. It's an easier way to get the things. You can also bring your foot up next to you while you put on your socks. Lift your legs up on a little stool or anything. So that way it's easier for you and you have more energy after you finish getting dressed. Loosely fitted t-shirts, always better than tight because even I struggle with putting on tight t-shirts because I'm just like, oh, this is hard. So yeah, the looser the shirt, the better it is to put it on. And then pants with elastic bands versus buttons. You know, sometimes zippers and buttons are harder on your fingers. They take more energy. So just wearing clothes that are bigger and just more with elastic, that'll help for sure. And then whenever, you know, you're really tired after a shower, if you want to use a robe, that's totally fine to dry off. You can just air dry. That's easier instead of having to use a towel and, you know, get everything all dry. All right. And then for bathing, they have different appliances on Amazon and different Marshalls, different kinds of stores. But like they have little organizers. And so it'll be like different tiers and it can go in your shower and you can put things at your height, the height that matches your level. So that way you're not having to constantly reach underneath, especially when you're showering and you're wet, because that can definitely be a big safety hazard. So keep items within reach, like even on the shower ledges, sometimes people have those, just keeping things at a good height. So you're not having to overbend. Electric toothbrushes, those are really good. Those are easier. You don't have to do much, just, you know, brush away. And then sitting during baths, we definitely recommend that because it goes into this next tip. Whenever the water is really hot, you will use more energy because you're getting less oxygen into your lungs. And so you're breathing more. And so whenever you do that, sitting will help a lot. So that way you don't fall or anything. But yes, the temperature of the water can increase your fatigue. If it's really, really hot, it's going to take more breaths. So that way you can get more oxygen into your lungs. And so, like I said, just using room temperature or cooler water will definitely help as hot water increases the energy that you use. Using scented products, I know we love them, but sometimes it can irritate your lungs and the way that you breathe. And so if it does that, then it's going to cause you to be short of breath and you don't want to not have enough air while you're in the shower. And then using a shower chair or tub bench, those are different things that you can use in the shower to sit down and enjoy it. All right, and just a little overview, really important to prioritize, plan your activities, pace yourself, take as many rest breaks as you need. The way that you position yourself while completing these tasks is important. Use any kind of assistive devices, and we can talk about that more if you're interested. Listen to your body. Stop and rest before you get tired. If you know that you need a break, just take that break. It's not worth it in the long run if you overexert yourself. And then rest often. And then lastly, thank you all so much for listening to all the way through. And so we'd love to hear your feedback. We are very open about giving presentations to the things that y'all want to hear. And then also, since we are in school, we do have to give out a couple of surveys just to hear what y'all think, what we can improve on. And so we'd love it if y'all could fill out this form. It'll just give us more insight on to things that y'all are looking forward to hearing. But thank you so much for listening. I really appreciate it. Hannah and I are both so glad that y'all listened through. So thank you.